Welcome to the latest in our series of TopMedTalks 2. In these podcasts, the TopMedTalk team is in conversation with global thought leaders in perioperative care. TopMedTalk.
Hello and welcome. My name is Desiree Chappell, and I'm joined this afternoon, by Dr. Zeev Kain. He is the chairperson of this meeting today, the Value-Based Care Conference on Orthopaedics. And he's also president of the American College of Perioperative Medicine. Zeev, thank you so much for sitting down with us finally. You have been so busy, the little busy bee running around. But this is absolutely amazing. Everyone we've had on the podcast this weekend has talked about the wonderful, overwhelming success of what you've done here this weekend. And I know it's been a lot of work. So tell us a little bit more about your background and why you decided this was important to bring these groups of people together.
First, thank you for having me. It's a pleasure to be here, and I think your podcast is right on spot, and you guys should continue this series. It's exactly the right thing to do. I like to divide my career into three parts. The first one, I was a pediatrician and anesthesiologist, and a pediatric anesthesiologist at Yale for about 20 years, doing a tremendous amount of perioperative stress research in children. I then moved to University of California, where I became the chair of anesthesiology and then the chief medical officer and the associate dean of clinical operations at the university. And I've done that for about 10 years. That's part two. Within part two, I realized that the process of delivering care is quite disjointed, and we all live in silos. And we started the whole concept of the perioperative surgical home and enhanced recovery. And so we decided within those 10 years to actually put up a couple of conferences on the topic. While putting on those conferences, I realized that even though the topic of the conference may be enhanced recovery or perioperative surgical home, the number of disciplines who come is still limited. And we still end up having mostly one discipline or another. So when I started my academy and kind of a new chapter, I said, well, I'm going to do it this time with everybody. And everybody means everybody. So this is the second annual meeting, and we have here anesthesiologists, nurses, orthopedic surgeons, physical therapists, healthcare coordinators, healthcare executives, physical therapists, I think I said that already, PM&R, and I'm sure I missed about 5 more specialties.
Yeah, and what I love about this meeting, you have patients as well.
Oh my God! And how did I forget? I just walked out from a meeting where I interviewed a patient for about half an hour, and we had a very engaged discussion when everybody asked the patient, "How do you feel about things, and what is your opinion?"
Yeah.
So that's why this meeting was born. The meeting was born to bring everybody into what I would call a neutral ground that is not a defined professional society, and so people feel comfortable coming here.
Yeah, you're doing what all of us really want so badly to happen in our professional lives as healthcare providers. You are breaking down those silos, and one by one, brick by brick, right?
Trying to.
It's a huge monumental task, but I believe firmly that this is where we have to start from the ground up when it comes to things like this. So that's great. So what has been one of your favorite discussions, topics, presenters at the meeting this weekend?
I will say that it was, in fact, the combination of the 3 talks of 3 orthopedic leaders. So we had Dr. Kevin Bozak, who is, I'm going to call him the priest of value-based care. And I'm saying he's the priest because he's such a believer and such a zealous, and he supported my conference, and he's a very, very good friend. And then we had, I'm going to say Dr. Todd Albert, who is the leader of the number 1 ranked hospital in this country in orthopedic care. And I think Dr. Albert's point was, that's very nice, but the reality is that we're not there yet. And HSS, by the way, is just so wonderful, which it is. So I didn't hear from him a big passion for value-based care. And then I had Dr. Alex Vaccaro, from the Rothman Institute, which he said it's number 4 in the country, but he's going to move it to number 1. I love him, and he's the physician for the Eagles. We just won the Super Bowl, so he's so happy.
Maybe
for that.
Maybe it was all due to him, right?
Yeah. Who knows?
They were in
You saw
great
him
shape.
kissing the Lombardi. And his approach is very different. He says, "Well, guess what? We think it's coming, and we're going to put a certain amount of our revenue per year, and we're going to develop these value-based care models because we think that's the future." So I almost thought the continuum from somebody who is zealous to it, somebody who is almost a disbeliever, to somebody in the middle who says, well, I'm just going to hedge my bets and move to that direction. I think that combination to me was very powerful.
Well, it speaks to everyone in the audience, for sure, because at some point we may have, if not, we start at the one point of it's not happening, I'm going to stick my head in the sand, and I would imagine that many of your participants here are headed in the direction of, Dr. Vaccaro, and hopefully to the point of Dr. Bozic, because he is so very motivating, and it's almost like a moral compass that we should all follow,
it is.
right?
He's our true north.
Yeah.
And I'm going to say the other highlight is not necessarily a specific talk, but the teams. So we had 68% of the entire audience in teams of 3 or more. That
Fantastic.
was it. And so every time I had a single registrant to the meeting, I reached out to them and I said, why don't you bring a team? And by the way, we gave significant discounts to people with teams. And that's what happened. And that to me is the big thing, because if my mission is to break silos and make an impact, I will not achieve it by a sole nurse anesthetist or nurse or anesthesiologist or physical therapy coming here. They will not have the gravitas to carry the message home. I need a team to come. And that, you have seen it. UCLA had 8 people here or so. That is a team, and now I feel comfortable that they will carry the message back home.
Yeah, absolutely. One exciting aspect of the conference that we've been talking to some of your participants, and it's really unique to get their perspective on, the takeaways and what they're excited about and what they can do to improve. And we've talked to several of the participants that are actually, they feel so confident going back to their facilities and like, we are actually doing the right thing, and this is affirmation for us. And I thought that was really cool, because I think there are a lot of people that are moving in the right direction. It's just, well, one reason why we're here today is to provide support to those people, because we live in our own little microcosms most of the time and don't have communication between each other, and we're having to reinvent the wheel, and you think, gosh, am I doing this right? What's someone else doing? So to know that, wow, we actually are doing things, kind of right, and we're moving in the right direction. I think that was really unique, a great aspect to the conference. So, well, we wanted to thank you so much for sitting down with us and allowing us and permitting us to be here and engaging with us, because this is really, truly the beginning of something very powerful, I think, and a way to reach the people that we try to on a daily basis and, again, break down those silos.
Yes, thank you. And I have to put a plug in. Please go to the website,
yes.
Dr. Zeev Kain .health. There is a podcast there, and the name of the podcast is The Collective Cure, and that's a series of interviews that are ongoing with leaders in the areas of breaking silos, not necessarily for medicine. I actually bring corollaries there from the business world to see how other people have broken silos and how they are doing that. So if anybody wants to know more about breaking silos, please go there.
Yeah, tell us the name of your site again.
The Collective Cure is the name of the podcast series.
Okay.
Just go to iTunes, type in The Collective Cure, and you're going to be right there.
Beautiful. We'll link it in our show notes so people will be able to find that.
Perfect.
Yeah. And how should we find you on social media and other ways to get a hold of you? Because I know you're all over. All over
social media. So I'm very
part-time
active.
gig?
Oh, yeah. I'm very active on LinkedIn. Please follow me on LinkedIn. I'm very active somewhat on Facebook and Twitter, The People's Doctor.
The People's Doctor, your Twitter, at People's Doctor?
Yeah.
Okay.
Yeah. So I'm there, but LinkedIn is really my platform. So please follow me and reach out to me. Happy to communicate.
Yeah, we'll look forward to the next wonderful multidisciplinary meeting about value-based care.
Thank you.
In the healthcare system. Thank you so much.
TopMed Talk.
Thanks for downloading and listening to TopMed Talk. Don't forget to find us on social media. We're on Twitter, Facebook, Instagram, even got our own YouTube channel. Whichever your favourite social media feed is, we're bound to be there. Find us. Also, subscribe to this podcast so that you never miss an episode. And make sure you go to the TopMed Talk website, topmedtalk.com, and get on board with the email updates. Oh, whilst you're at it as well, I suggest you download our entire back catalogue. We're categorising at the moment. We're having a little look through it. It may not always be in the form that you currently find it. So if you get your hard drive ready for a full-on download via the website perhaps, or perhaps through your podcatcher. Oh, and if you fancy meeting us, why not go to the website ebpom.org/meetings. Our next big event is EBPOM USA, the Dallas Masters Course, a perioperative care practicum. Have a look for details of that and some of the other meetings coming up across the next year. ebpom.org/meetings.